everyone, I'm Dr. Sonal Katyal. Today I'm here with a new topic of discussion which is called as Planetary Health. Today we will be discussing this particular topic considering in mind the global health crisis that is going on and the interconnected things or the repercussions that can happen because of those crisis, and what are the after effects of it, how it can impact the future generations. What is this term planetary health all about? So let's begin. So before moving ahead, let me give you a brief introduction about what is going on with respect to the different statistics of healthcare indicators. So United Nations Development Program has been making a lot of progress with respect to all these indicators of MCH, like maternal and child health, life expectancy, and other healthcare issues. Now, from the time the COVID-19 has happened, it has shown that we all the risks are basically interconnected in nature, which is related to development. And also, it has highlighted the various factors or the various problems which come in between all of this, like social, economic, and environmental. Now, this was about that where to start, like the discussion, right? So it's related to healthcare indicators, and where we are during COVID-19 and now, of course, post-COVID-19. So planetary health. Now, what is planetary health? Planetary health gives us the understanding of dynamic and systematic relationships between global environmental changes and their effects on natural systems, and how changes to natural systems affect human health and well-being at global, regional, and local levels. So it considers both static, dynamic relationships, and when we talk about healthcare, we have seen during COVID-19 that no crisis is only limited to one country. A crisis can be of global nature. So whatever changes need to be made at all the levels. Now, the Rockefeller Foundation and Lancet Commission on Planetary Health have defined it as the achievement of the highest attainable standard of health, well-being, and equity worldwide through judicious attention to the human systems, political, economic, and social, that shape the future of humanity and the Earth's natural system, that define the safe environmental limits within which the humanity can flourish. So whatever standard we have to achieve, it has to be of highest level, and it has to be at the systematic level, right? So planetary health gives an alternate solution. How? By examining the various factors as mentioned earlier as well, political, social, and economic systems for a more resilient future. According to the United Nations Framework on Climate Change, planetary health is a new field to give and guide solutions to protect our own health. Now, there's this new agreement which is called as the Paris Climate Change Agreement, which explicitly links the climate action with healthier environment, cleaner air, and reduced risks of extreme heat waves in order to check the spread of diseases. United Nations has introduced UN Global Climate Action Awards for planetary health, which shows how communities are creating new ways to use the planet's resources wisely to protect their health, and that can serve as a model for others. So the actions have been taken all over with respect to planetary health and for the betterment of the society as a whole. Now, though planetary health is a relatively new topic, but these are the new terms that are coined every few years with respect to health. So few people have done research and have contributed in this area. So one such study was conducted in 2016, or rather published in 2016, which says that if you want to for successful implementation of this, you need to have three things. Firstly, the community should sponsor an ongoing program to inform policymakers about the different health-related threats, the importance of the health-oriented strategies, and also at the same time the resources that are needed to support these strategies. Secondly, closed and sustained coordination with other sectors which are consistent with the health in all policies approach and the right to health principles and US agencies that serve non-health sectors and the UN Framework Convention on Climate Change to implement the Paris Agreement, and also consider population health impacts, okay, that can for climate change mitigation and adaptation strategies. And thirdly, it is very essential for the public health community and population. They should become the part of government institutions which lead healthcare adaptation strategies in the United States and are related to Paris agreements and others as well. So all of these steps or all of these changes should be made for the successful implementation. Now, there was a key message that was given by the Rockefeller Foundation Lancet Commission on Planetary Health, which kind of sums up the discussion or what we have discussed in today's video, which says that solutions lie within reach and should be based on the redefinition of prosperity to focus on the enhancement of quality of life and delivery of improved health for all, together with respect for the integrity of natural systems. This endeavor will necessitate that societies address the drivers of environmental change by promoting sustainable and equitable patterns of consumption, reducing population growth, and harnessing the power of technology for change. So, I think this message sums up our discussion for today. I hope you have learned something from this and you have learned a new term or something, a new discussion that has been started all across the world. And it will add on to your knowledge. I had written a piece, an editorial related to the similar topic for one of the journals. So you can refer to that if you want more details related to this, and all the other references would be there in that particular writing of mine. So thank you so much. I'll see you with another video.